Hi, it's Dr. Robert Brueck coming to you from Southwest Florida with another segment of What's New in Cosmetic Surgery. You know, a lot of times people ask me, what's the future? You know, where's aesthetics going? I think if you look at mega trends, if you will, obviously more and more people are looking for outpatient procedures, looking for procedures that have minimal downtime. And I think that's sort of the trend, and I think we see that in the rise in popularity of injectables, non-invasive fat removal, and things of that sort. But a recent survey of facial cosmetic surgeons they were asking what do they see in their practices as far as trending and what's coming in. And one of the things they said was that 64% of physicians surveyed saw an increase in cosmetic procedures among those people under or less than 30 years of age. 82% said that a lot of this motivation came from social media, Facebook, Twitter, Instagram, things of that sort. In my own practice, I see more and more young people starting to come in to inquire about things such as fillers, Botox, and things of that sort. You know, and at first I was a little skeptical, wondering, you know, where do you go from here? But when you think about it, it kind of makes sense, because as we age, our skin thins and we get sun damage even if we use sunblock. And as a result of that, lines and wrinkles become more ingrained. So the more you fold a piece of paper, the more a muscle contracts, the deeper and more ingrained that line becomes. So I see young people coming in 20, 25, 30, 35 years of age requesting Botox because they say, I don't want to look like my mother. And then of course they see those famous celebrities. They see the Kardashians and all these young phenom singers, and they want to have that youthful look. So I think more and more people are coming in because they want to forestall the development of deep line. The other thing that I think is driving this is the famous, infamous Groupon. Groupon, people come in and say, I got this Groupon, get 20 units of Botox free when you buy 20 more, things of that sort. So that, I think, also is causing people, especially young people, to come in requesting more and more procedures. So we do see a shift towards younger patients for non-surgical procedures. Now, if we look at the whole scheme of things and we look at the broad picture, what are some of the common trends that we see? And again, in a survey of facial cosmetic surgery, and this was surprising to me, the #1 trend was a natural looking rhinoplasty. I have to say, in my practice when I do a rhinoplasty, I've always been interested in creating a natural look. I don't want it to be over operated, I don't want it to be unnatural, and I want the nose to fit the patient's face. So a natural looking rhinoplasty was the #1 request from people coming in to see facial cosmetic surgeons. The second most common trend, if you will, was what we might call combination therapy. In other words, somebody comes in for a mini facelift, but then they want some fillers, they want some Botox, or they want a mini facelift and they want some fat injection. They want a neck lift, they want a laser resurfacing. So combination therapy was the second most common thing people requested. The third, which I think is a home run, was an upper lid bleph. I've always said and maintained that two things that I think really do matter and make a significant difference in people's appearance is #1, an upper lid eyelid or a blepharoplasty, and 2, a breast augmentation. Those things I think really have a home run effect on people's visual appearance, their self-confidence, their look. So blepharoplasty definitely is a great procedure. And it's a simple enough procedure to do. There's minimal downtime. My patients usually shower the next day, shampoo their hair, but I do give them a word of caution. Get a baby shampoo so you don't knock out the stitches. The fourth trend that facial cosmetic surgery people saw was people coming in requesting, I want my cheekbones back. Yes, the cheekbones. And I think it's because of the fact that as we age, and I always tell my patients, everybody's aging, we lose volume. And a lot of times the soft tissue overlying the cheekbone diminishes. As a result, we don't have the highlights to our cheekbones the way we want. So a lot of times people come in asking for Voluma, which is a hyaluronic acid filler just for that purpose. But a lot of times what I recommend to people is, why not do fat? it's more cost effective, you can get greater quantities, and it's natural, it's your tissue. So Cheekbones was number 3. The last one was the injectables. They're always going to be popular. People wanting injectables. The number one injectable, of course, would be the Dysport, the Botox, the neuroleptic agents to paralyze. And of course, right behind that would be the fillers, the hyaluronic acids, the Restylane, the Juvederm, the Radius, things of that sort. So those are the things that people that are facial cosmetic surgeons see as far as trends. Natural nose, combination therapy, blepharoplasty, cheekbones, and injectables. I read an interesting article. It was interesting to me because it's a name that's in the news all the time. And that had to do with the country of Iran. You know, we hear about Iran all the time and the peace treaty, the nuclear deal to prevent them from getting a nuclear weapon. And of course, I think it's not for peaceful means, but for nefarious means. Be that as it may, it's a very conservative Muslim Islamic state. So women aren't held in high regard. And for many, many years in Iran, there were only 2, and I found this interesting, 2 cosmetic procedures that were allowed. Rhinoplasties in women and hair transplants in men. But now there's been a sudden surge in the number of requests for rhinoplasties. They have the highest per capita, if not one of the highest per capita requests for rhinoplasties in Iran than ever before. And the price of a rhinoplasty is about 5 times the monthly salary of the average Iranian citizen. The average Iranian citizen makes, you want to take a guess? About $270 a month, $300 a month. So rhinoplasties, last year they performed over 80,000. For a country of their size, that's a significant number relative to their population. So rhinoplasty is a very popular procedure requested in Iran. And the societal theocratic regulations concerning it have been lessened, so more and more people are now able to get it. But because of the legal ramifications, many of the procedures done in Iran are sort of clandestine, behind closed doors. It's not an open and free society like we have here in America. But it's interesting that rhinoplasties are probably the #1 requested surgical procedure in Iran. It's kind of interesting. The other thing I think is important, I read an interesting article about acne and microneedling. Microneedling, I think, is a new technology, therapy modality that's going to be more and more popular. One of the big reasons it's popular is it's outpatient. There's really minimal downtime. And what it is, it's a handheld device wherein we take and make multiple needle sticks on the face. It's painless. We put a topical anesthetic cream on, and then we go ahead and do the microneedling. And some people call it collagen induction therapy. So a lot of times what I do is people come in, we numb their face, we draw off their platelet-rich plasma, which we get from 10 cc's of their own blood. And then we go ahead, and once the face is numb, we take this device, which is like a handheld pencil device, and we make multiple little puncture wounds with a microneedling handheld device. Then once that's completed, we take the PRP, the platelet-rich plasma, and then we rub it into the areas. It's very effective in rejuvenating sun-damaged skin. It's very effective. This article that I saw had to do with the use of microneedling in improving acne. And I always tell people, when you have severe acne scarring, it's not one size fits all. Usually with acne scarring, it's a multi-modality type of therapy. Microneedling with PRP is one modality that can be used to treat this. Another interesting thing was PRP for stretch marks. I read an article and they had 3 groups of patients. One group of patients had intradermal injection of PRP. The second group had microdermabrasion, which is similar to microneedling. And the third group had the microneedling plus the intradermal PRP, the combination. And those that had the latter, that is the microneedling, microdermabrasion plus PRP, had a higher, significantly more increase in the appearance and improvement of their stretch marks. And I find that interesting because I think you're going to see more and more studies being done to compare microneedling in the treatment of problems with vitiligo, treatment of melasma, brown discoloration from, for example, sun damage, or brown discoloration from birth control pills, acne scarring, and things of that sort. So microneedling is going to be a big player in the future. There's minimal downtime. But I think it's also important to understand that one microneedling treatment is not going to all of a sudden make you look 18 years old. In my practice, I recommend people get a series of 3 as a minimum, and spaced out over a course of maybe 4 to 6 months. And I think you really need to do that. And that, in combination with a good skincare program, can really give somebody a much healthier looking skin complexion. So microneedling is a thing that I think you're going to see more and more of. The other thing that I want to talk about as we conclude this session has to do with non-invasive fat removal. Many of you have probably had and or have heard about CoolSculpt. That's the process whereby you have a device that will freeze the fat. It's been very popular. As I drive around town here, I see all these advertisements for CoolSculpt. Well, there's a new kid on the block. Cynosure, which is a company, produced a new device which has just received FDA approval called SculpSure. In fact, we're going to be getting a device probably sometime in February, and you'll be getting more about that later. SculpSure is, I think, a far more effective way to lose unwanted body fat. It's a device that melts the fat as opposed to freezing the fat. And what they found in studies that when you have CoolSculpt, the treatment head has to be in touch with the body parts you're treating for about an hour. So let's say somebody has 4 areas of fat on their abdomen they want treated. We're talking about 4 hours of in the doctor's office with CoolSculpting. And it's not, from what people have told me, without discomfort. CoolSculpt, on the other hand, has 4 treatment heads. So theoretically, you can treat 4 areas at the same time, and it's only 23 minutes. Now, there's no downtime, there's no pain. Once the treatment head is placed on the skin, there's a laser beam penetrating through the skin to melt the fat. And what happens over the course of the next 4 to 6 weeks, 3 weeks, whatever, your body's immune system will absorb and take away the devitalized fat cells that have been lost. Most people in the studies have seen a decrease of about 3 millimeters or 24% of the layer of fat over the area that's treated. Again, it's outpatient. In fact, really, when you think about it, you could come in at lunchtime, have a 23-minute SculpSure treatment, and go back to work the next day. There's no anesthetic required or anything of that sort. So SculpSure is going to be, I think, a nice way for people who have certain deposits of fat they want to take care of. They don't have time to go ahead and get a long-standing recovery from liposuction and the like. And it's outpatient. And you can have more than one treatment. Usually you wait 6 to 8 weeks between areas. So for example, you could treat the abdomen, come back in 6 to 8 weeks, or actually 3 to 4 weeks, and treat your back area, flank area. So it's really a neat technique. Minimal downtime, no injections, no pain. It's called SculpSure. And we certainly will be promoting this more once we get our device, and we're hoping to get it soon. And if you want to come in for a preliminary evaluation, you certainly can. And I think it's important when you're doing things relating to body contouring that you go to a board-certified plastic surgeon, because somebody may come in that's 250 pounds thinking SculpSure is going to melt their fat and they're going to get down to 200. It's not the case. So I think it's important to come into a board-certified plastic surgeon so that you can be evaluated correctly and then develop the best course of treatment and correction for you. So again, I want to say thanks for tuning in. And again, if any of you have any questions about ideas or things you've heard about that you'd like me to comment on or explore, feel free to go to rjbrueck@abodyandface.com and email me. Or you can go to my website, beautybybrueck.com, and connect with me that way. So again, I want to say thanks and hope all is going well in the new year. We look forward to coming to you with new, exciting information, technology. And again, we're going to give you some updates on SculpSure as they become available. Take care and have a wonderful day, and God bless.